During the 2015-16 school year, the Michigan High School Athletic Association conducted an unprecedented study of head injury reports from its member schools designed to quantify and further reduce future incidents of such injuries. The mandated reporting came in from 99% of member senior high schools and found that for the past school year, 4,452 concussions, an average of 5.9 per school or 1.6 per thousand participants, took place. The association anticipates that various groups will study the data to apply to equipment and game rules designed to make competition safer, and it will also work with the Youth Sports Institute at Michigan State University to develop coaches' education programming around the results.
This will allow us, for the first time, to establish baselines by which we'll be able to measure our progress year over year in reducing head injuries in all of school sports. And it will help us to raise questions that we will seek to get answers from with our research partners across the state and perhaps the nation.
2/3 of the verified concussions occurred in competition. 28% of the concussed athletes returned to play in between 6 to 10 days, and another 20% required 11 to 15 days of rest. Perhaps most interesting was the fact that head injuries sustained by girls and boys in the same sport had a wide disparity. In soccer, 30 girls per thousand compared to 18 per thousand for boys. In basketball, 29 per thousand for girls, 11,000 for boys. And softball players reported 11 concussions per thousand, 4 per thousand for baseball.
We hope to identify the physiological or social or psychological factors that contribute to this disparity in reporting of head injuries by boys and girls. And we want to use the answers to these inquiries to better prepare school personnel, especially coaches, who may be coaching girls who are over-reporting or boys under-reporting in competitive interscholastic athletics.
Football recorded the most concussions, followed by ice hockey, 8-player football, girls soccer, and girls basketball. The data collection is already underway for the new school year, part of a sustained comprehensive concussion care program by the MHSAA. It is also conducting the nation's largest sideline concussion testing program and was the first state association to provide high school participants with concussion gap insurance, designed to pay deductibles and copayments left unpaid by other policies.
We are addressing education and detection and aftercare in unprecedented ways. We're proud of what we've done, but we're far from satisfied. We're going to continually be on the lookout for ways to make school sports even safer than they are already for the boys and girls who compete in educational athletics.
Michigan was among the first state associations to adopt a return-to-play protocol, which prohibits further competition on the same day of the suspected concussion, and that only allows the athlete to return with an unconditional sign-off by medical personnel. Its modified in-season football practice full contact policies have been found in one study to reduce head impacts by over 40%. This is John Johnson reporting in East Lansing.